of Hawaii, we share their loss and express our deepest sympathy and support. Today marks the second Friday of my statewide stay-at-home mandate, and I know this is not getting easier for anyone. As I've said before, unfortunately, it's going to get worse before it gets better. With the number of positive COVID-19 cases in Hawaii increasing each day, and the heartbreaking loss of 3 of our fellow residents, we all need to remain vigilant and do our part in stopping the spread of COVID-19 and flattening the curve in our state. Dr. Bruce Anderson is here to provide details and the latest updates from the Department of Health. Also, just a few hours ago, the CDC updated their guidelines recommending that everyone should wear a cloth mask when in public. I support this recommendation and encourage you to do the same. It's important to remember that the public should not be wearing N95 masks or surgical masks. This type of personal protective equipment and others like it should be reserved for our healthcare providers and first responders. And remember, even when wearing a mask, the best way to prevent the spread of COVID-19 is keeping your distance, staying away from each other. Today, I'm announcing that I've ordered the partial activation of 4 units of the Hawaii National Guard. Effective immediately, there will be more than 250 men and women on state active duty. They will provide assistance to the Hawaii Emergency Management Operations Center, the State of Hawaii's Joint Information Center, and support the receiving and distribution of medical supplies and PPE from the National Strategic Stockpile. HIEMA Director Ken Hara and Brigadier General Moses Kauivi will provide more details. Also here today is Hilton Rathel, President and CEO of Healthcare Association of Hawaii, with an update on Hawaii's healthcare professionals. He will also share how our community is helping those on the front line of our fight against COVID-19. One of the programs that directly supports healthcare workers is the Hotels for Heroes program. Chris Tatum, President and CEO of the Hawaii Tourism Authority, is here with more information. And as a reminder to those small businesses who have been harmed by this crisis, today is the first day that financial institutions are accepting applications for the CARES Act Paycheck Protection Program. This program will provide forgivable loans for small businesses to pay their employees during the COVID-19 crisis. If you have not submitted your application, you should do so right away. The funds will be awarded on a first-come, first-served basis. There have been reports of visitors arriving in Hawaii who are homeless. Yesterday, I instructed Director Hara that if anyone arrives at our airports without a place to stay, they will be immediately sent back. And finally, I'm also announcing an effort to address the issue of overcrowding and preventing the spread of COVID-19 in Hawaii's correctional institutions. I've asked the President to allow Hawaii to transfer state inmates to the Federal Detention Center in Honolulu. We have a long-standing contract to rent cells for OCCC inmates at the Federal Detention Center, but at the present time, they are not accepting inmate transfers, even though they are not at full capacity. As we prepare for the weekend that is no longer filled with your kids' sporting events, family parties, or a day at the movies, please reflect on what you can do to help your neighbor and our community. The only way for Hawaii to deal and survive this crisis is if we all work together. Take care of yourself, take care of each other, take care of our community. Thank you.
Thank you, Governor. Our next speaker is Bruce Anderson, Director, Department of Health.
The Department of Health is sad to report our third COVID-associated death here in Hawaii. Let me extend the governor's condolences to his family and friends for their loss. The individual was an elderly adult, a resident of Hawaii, who has been in critical condition on life support for several weeks. He became ill in early March after traveling to Washington State. Washington State is one of the places in the country which is suffering from widespread illness, distribution of the virus at this time. It's certainly a tragic reminder that the spread of COVID-19 is a serious threat to everyone. It's a very contagious and very virulent disease. The department is also reporting the first positive COVID-19 case on the island of Molokai. The adult had a history of travel to Las Vegas. The investigation by our Maui District Health Office is still underway. The individual has been transported back to Honolulu for hospital care. Today's count includes 34 new positive test results. With these new cases, there are a total of 319 cases to date. All of today's cases are adults, 30 are residents, 3 are visitors, and 1 is currently under investigation. Since the end of February, a total of 78 cases have been released from isolation, including 6 from what was reported yesterday. Of the 319 presumptive or confirmed positive cases to date, 270 are Hawaii residents and 25 are visitors. So the vast majority of cases in Hawaii are still Hawaii residents. The department is continuing to aggressively investigate cases reported and in tracing contacts. Most of these are now being reported through private clinical labs. And to date, there are over 12,000 laboratory results conducted by those laboratories for COVID-19. Earlier this week, we posted an epidemic curve on our website, and I wanted to spend a minute or two going over that with you all. Behind me on the chart there is the curve that everyone talks about, and when we talk about flattening the curve, what we're trying to do is keep the number of cases below a point which stresses our healthcare system. You can see in the red there what would happen if we didn't do anything, and we hope as we keep the case numbers down, we'll be able to get through this without putting undue strain on our healthcare system. This is what our epidemic curve looks like at this point in time. This is just the beginning of the outbreak, and is somewhat misleading in that it reflects what was happening here about 2 weeks ago. And as you may see, the cases that have been recently reported are not included on the curve. The curve is a good description of when the date of onset was for the cases, and that may be as long as 2 weeks before we get a report of the case. An individual would become sick, probably after a few days, when he or she went to see a physician, and often it takes a week or so for us to get the test results back. So we're looking, when we report these cases, at a period of time that is probably a week or 2 before that time. So as you look at this curve, you'll note that the vast majority of cases that we've seen so far are Hawaii residents who have traveled. The dark blue on this bar chart are Hawaii residents who have traveled. There are the lighter blue bars represent the individuals who are non-Hawaii residents who have arrived here, and the orange color, the salmon color there, is the individuals who have no travel history. These are individuals who may have come into contact with individuals here, but we have not been able to document that. That's what we're worried about most, is the fact that they may represent at least limited community spread. And again, let me emphasize that we haven't seen where this curve is going at this point in time. We're very early in the process. Hopefully we'll have eliminated most of the travel associated cases as the governor has recently put the quarantine requirements in for all incoming travelers. This is posted every day on our website, and I would encourage you to keep track of where this goes. It's not a terribly good predictive tool, but it's very helpful to know what's been happening to date and helps us in our control efforts. Finally, I wanted to announce that the Centers for Disease Control has issued new guidance on the use of face masks for the general public. CDC now recommends wearing cloth face coverings in public settings where their social distancing measures are difficult to maintain, for example, in grocery stores or pharmacies. It's also important to emphasize that maintaining a 6-foot physical distance between individuals remains the most important factor in slowing the spread of the disease. CDC is additionally advising the use of simple cloth face coverings to slow the spread of the virus and to help people who may have the virus and do not know it from transmitting it to others. This is a voluntary public health measure which complements other measures. It is most important to remember that masks are not substitutes for stay-at-home orders and are less effective than frequent hand washing, avoiding touching your face, and simply staying away from other people. The cloth coverings recommended are not surgical masks or N95 respirators. As the governor indicated, those are precious and needed by our healthcare workers and first responders. There is no need to wear a cloth mask when you're outdoors and not in close proximity to anyone else. Fresh air, of course, is good for you. As long as you're not around other people, there is really no risk of being exposed or infected. So we do encourage people to walk, to run, to surf, but practice social distancing. Stay away from others, and don't hesitate to remind others to do the same. Thank you very much.
Thanks, Dr. Anderson. Our next speaker is Chris Tatum, President and CEO of the Hawaii Tourism Authority.
Aloha. Thank you for giving me this opportunity. You know, we rarely have an opportunity to properly thank our heroes. This is our chance. We're working with HTA, HLTA, and HVCB to do the proper recognition of the heroes in our community. You know, my dad always said a hero is someone who sacrifices and puts self in harm's way to protect and help others, asking nothing in return. I always thought that was really focused on the military and our first responders, which I still believe. However, we know we've got other heroes in our community right now, and that's our healthcare workers. So what we've done is put together a program called Hotels for Heroes. We put the call out to all of our hotels. We need to have an opportunity for our first responders and our healthcare workers to get a chance to rest after tirelessly working throughout tremendous shifts, and also have a chance to maybe get away and have social distancing from their families. So we put the word out, and we've received 33 hotels that want to participate in our program. And we have, we're working with the healthcare community, the police, the fire department, and emergency services to provide them with hotel rooms when they need them. And so our expectation is we're gonna start on Monday. We're taking reservations right now, and we look forward, I know the hotels look forward to taking care of these heroes. And we appreciate the opportunity, and we thank them so much for what they're doing for us every day. Mahalo.
Thank you very much, Mr. Tatum. We're going to take just a 30-second or a minute break right now because we're having some technical difficulties with our Facebook Live. But our next speaker to come up here is Hilton Raethel, President and CEO of Healthcare Association of Hawaii. Mr. Raethel, if you could just hang out at the podium, and we will have you start up in just a few seconds.
We are very appreciative of the hotel industry's generosity and collaboration in the Hotels for Heroes campaign. Our healthcare workers appreciate having a place to rest between their shifts, and this campaign allows them the opportunity to protect their own families while they take care of patients. Our healthcare workers, as Chris said, put themselves on the front line every day. They were doing that before this pandemic, they're doing it during the pandemic, and they will continue to do that when this pandemic is behind us. The hotel industry's generosity shows a true aloha spirit and support for our healthcare workers. Thank you, and Chris, please convey our thanks to all the leadership in the hotel industry. We're very appreciative. We know that this is a very tough time for Hawaii. The Healthcare Association of Hawaii, in collaboration with its members across the state and with the governor, the lieutenant governor, the Department of Health, and General Hara and his team, is doing all we can to support and serve the people of Hawaii during these challenging times. In these tough times, many individuals and organizations have stepped up to help, and we would like to recognize just a few of them. Brewers and distillers across Hawaii are making hand sanitizer and cleaning products for healthcare and other organizations. Byron from Pharmacare, a specialty pharmacy that mixes compounds for pharmaceuticals, and who is one of our members, has provided his expertise to the brewers and distillers. To Byron and the brewers and distillers, thank you. Home Depot has donated cleaning supplies and PPE for the homeless shelter, and has also donated face shields and other PPE to our emergency management warehouse for distribution to healthcare organizations across the state. The Bank of Hawaii Foundation has donated $100,000 for the purchase of additional PPE and supplies. To Home Depot and Bank of Hawaii, thank you. A hui that includes HBU, Iolani, Punahou, and other educational institutions, working with organizations such as Hawaii Pacific Health, are 3D printing headbands for face shields. The hui is working to standardize the design and manufacture to make the 3D printing as efficient as possible. The Healthcare Association is working with this consortium to source raw materials and support the production, assembly, and distribution. To the 3D printing hui and its supporters, thank you. Lieutenant Colonel Mary Kruger and her team at Tripler Army Medical Center is working with the Healthcare Association and our members across the state on surge planning, procedures, and coordination. Colonel Kruger and her team have been outstanding partners, and we salute and thank you for your service.
Thank you very much, Mr. Raethel. Our next speaker is Kenneth Hara, Director of the Hawaii Emergency Management Agency. Kenneth.
Good afternoon and aloha. At the direction of the governor, yesterday I partially activated the Hawaii National Guard Joint Task Force, or HING-JTF, and 4 units of the Hawaii National Guard to conduct National Guard civil support operations. Brigadier General Moses Kauivi Jr. has been designated as the commander of the HING-JTF, and he will be providing more details on the activation, the ongoing missions being conducted by the Hawaii National Guard, and the anticipated missions of the HING-JTF. Thank you.
Thank you very much, Director Hara. And our final speaker is Brigadier General Moses Kauivi Jr., Joint Task Force Commander, Hawaii National Guard.
So aloha kako. I'd like to thank Governor Ige and Major General Hara for this opportunity as the Hawaii National Guard Joint Task Force Commander to lead the Hawaii National Guard civil support operations in the state of Hawaii. As many of you know, the Hawaii National Guard is homegrown. We are the sons and daughters of Hawaii, and the Hawaii National Guard has consistently played a major role in supporting the communities of Hawaii in any type of disaster. And as our state faces the daunting challenge with the COVID-19 virus, we are here again today to provide the necessary support to the state of Hawaii. Currently, our service members are on state active duty providing the following support. We're providing assistance to the Hawaii Emergency Management Agency in Emergency Operations Center activities and planning for the COVID virus. We're providing support to the State of Hawaii Joint Information Center to communicate accurate health and safety information to the public. And we're also providing warehouse support to Hawaii Healthcare Emergency Management for receiving, conducting inventories, and repackaging medical national stockpile equipment, supplies, and personal protective equipment for distribution. We're also currently activating soldiers and airmen for screening support to the airports. We expect them to be operational by Monday, 6 April 2020. We also anticipate that the Hawaii National Guard may be needed for additional assistance, and that's why General Hara activated the 4 units in the 4 counties. We believe that we may be needed to assist in providing support to law enforcement, for security, and also law enforcement of the supplemental proclamations and executive orders. We may be also needed for wide area search and rescue. We also may be needed to assist the county emergency management agencies in planning management and control of immediate threats to the COVID-19 virus. We also are there to provide support to healthcare professionals with sample administration, assessments, wraparound services for those sheltered, emergency medical transport, and site security. We may also assist in training first responders in the proper use of personal protective equipment and other type of training involving protective actions in the COVID-19 environment. And lastly, we may be also needed to help disinfect and clean key government and public spaces as needed. We'll be conducting these missions as the need arises, and we will have National Guard soldiers being activated on every county. Thank you.
Thank you very much, Brigadier General. Our first question, we open it up now to questions from the media. Our first question is for Governor Ige and possibly Director Hara. I'm sorry, Director Hara, you're next. This is from Eleni Gill at Civil Beat. What unintended consequences are you concerned about if the President were to stop travel to Hawaii?
I've had extensive discussions with the FAA and other federal officials. Our 14-day mandatory quarantine for all incoming travelers is the best way for us to stop visitors from coming into our islands. The unintended consequences is about who controls. No one can stop individuals from getting on aircraft in any of the public airports all across the country. We do believe that the most effective way to manage who comes to our islands is through the 14-day quarantine. We are working with county law enforcement officers to ensure that we can enforce those quarantines.
Okay, Governor, stay there, and I think maybe Director Hara, you may be needed here. Manola Morales from KHON2 is asking for a clarification on why the National Guard is needed for medical supplies.
Certainly, the National Guard are trained to do a wide variety of activities. They're very organized. They're flexible, and they have extensive training packages to prepare individuals, men and women, to respond in various different ways. We are getting large shipments of personal protective equipment, and they have to be moved to healthcare facilities all around the state on every island. I think that's an important function in order to keep our healthcare professionals protected, and I'm certain that General Hara can provide additional information.
So what that team of 5 individuals are doing is they're assisting the HHEM that's breaking down the National Strategic Stockpile. So just providing some additional manpower to do inventories and then setting up the shipments out to the different counties and to the medical personnel. So they're just assisting the warehouse operations. Thank you.
Okay, Director Hara, please stay there. We have a question from, from Ashley Mizuo from HPR. Her question is, what is the timeline for the building or establishment of alternative healthcare facilities?
So I'm waiting. The last assessment was done today. I'm going to try to meet with the Army Corps of Engineers either this weekend, if they're not available, then Monday. And then probably that same day we could make a determination which facilities we want to build out. And it depends what we decide on. Right now we're probably leaning towards using the Hawaii Convention Center for Oahu to kind of decompress the hospitals if we get a surge. But still have not made that decision yet.
Okay, thank you,
Thanks.
Director. Governor, a question from Daryl Huff at HNN. Your Chief of Staff told senators today that Hawaii wanted to close airports, but the FAA refused and threatened to withhold funding if Hawaii tried to stop air traffic. Is that accurate, and when was that request made?
We've had extensive discussions with the FAA, and they made it clear that to shut down an airport is not possible. We've explored different options. Airlines cannot discriminate in who gets on an airplane. There are other administrative and other logistical challenges with directing only essential employees to be able to travel to Hawaii.
Okay, Governor, also this is from Max Dybel at Big Island Now. As part of an emergency proclamation, you suspended narcotics laws, allowing doctors to issue prescriptions to patients they've never examined via telehealth appointments. Why were medical marijuana certification processes not extended the same exemptions? And do you have any plans to address medical marijuana certification during this time of mandated social distancing?
You know, we will look at all the impacts of the actions taken and making adjustments to the emergency proclamations as necessary. Our focus was ensuring that we have the healthcare professionals here to be able to provide services to our community. We believe that telehealth would be an important asset that would allow us to protect not only our healthcare professionals, but also extend the reach of healthcare services into rural communities that may be challenged during these COVID-19 times. So that's the purpose. You know, we are looking at and evaluating all the actions necessary virtually every day to decide additional actions, proclamations, and executive orders that would allow us to keep our community safe, and most importantly, to flatten the curve and defeat this COVID-19 pandemic.
Governor, another question for you. This one from Rick Kwan, KITV4. Have you read the letter local mayors have sent to President Trump? And if so, what are your thoughts, and do you intend to support that measure?
Now, as I said before, I do believe that the 14-day mandatory quarantine can be a very effective way to keep travelers out of our community. We requiring a 14-day mandatory self-quarantine will assure that we discourage those who should not be here. I've had extensive discussions with the FAA and other federal officials, and that request would be very difficult to implement and impossible to enforce. So we are looking at real ways to keep our community safe. I would also like to note that yesterday we had 0 visitors coming from Japan. You know, I do believe that the mandatory quarantine is effective. We need to all work together, all the counties and the state, to enforce the implementation of the 14-day mandatory quarantine.
Thank you, Governor. Our next question is for Bruce Anderson, Director, Department of Health. Dr. Anderson, this is from Kristen Concilio at Star Advertiser. Ambulances responded this week to the Pride of America for possible COVID patients. How many people were on that ship, and how many were positive, and where are they now?
I'm not familiar with the details there. I recall one crew member was identified as being positive and is in isolation. I would have to look into that and get back to Kristen.
Okay. Dr. Anderson, please stay there. You have a couple of more questions here. This is, hold on just a second, from Daryl Huff, HNN. With the additional cases added today, are you seeing any clusters or patterns? And will you start putting actual numbers by zip codes instead instead or along. Daryl, this isn't making sense here. Okay, so basically your question is, with the additional cases added today, are you seeing any clusters or patterns, and will you start using zip codes to inform the public?
We're actually using census tracts now. But first to his first question, we've seen situations where individuals in the same family have been infected. We've seen other situations where people have been in the same gathering and have been infected, probably by the same source. So we're seeing some clusters of illness, but it's only been in social settings or other settings where you would expect that to occur. So far, we haven't seen any widespread transmission within any particular community. The maps we published and are available now on our website show the census tracts of the individuals who are identified as confirmed cases. And if you look at those maps, you will see that there are more cases in some census tracts than others. The likelihood of those being associated with a common source is probably very small. In fact, if you note the numbers of cases, the higher numbers are typically associated with census tracts with high socioeconomic status, and probably are associated with travel. There are simply more people traveling and having that opportunity to be infected. As you may see on the spot map, the epidemic curve here, most of the illnesses we've seen in Hawaii have been associated with U.S. residents going to places with COVID-19 and being infected there, bringing the disease back with them and coming here. That's one of the reasons why the governor's restrictions on travel, I think, are so critically important.
Okay. Dr. Anderson, one more question. This is from Kehau Curzio from Maui News. Her question is, what is the state doing to assist Molokai, which doesn't have medical resources to sustain an outbreak, and how can residents of rural communities like Molokai and Hana that are more vulnerable take extra precautions?
Well, the precautions that we're recommending apply to everyone, even those in rural communities where physical distancing isn't as much an issue, perhaps, as urban areas, but certainly we'd encourage everyone to avoid being in close proximity with others. Even family members can be infected without knowing it. The neighbor islands, and particularly Molokai, is challenged because their healthcare system is not as well developed as others. They have an excellent hospital, but it simply doesn't have the resources available to it that we have here on Oahu. In fact, the case that was identified today was initially transferred from Molokai to Queens here, and is being treated here to be sure that that individual is getting the best care that's possible. That's one of the reasons why the medical exemption for the inter-island transport is so important. We recognize the need to be able to get residents who are in rural areas to the healthcare facilities that can properly support them. So my advice would be, of course, to continue to practice physical distancing, whether you're in a rural area or not. If you're ill, do see your physician, and even on the remote areas, the physicians can order the tests and have them done if they need to do that. So we're reaching out, and HAH, the Healthcare Association of Hawaii, is supporting all the hospitals around the state, including those in the rural areas.
Dr. Anderson, another question for you. This is from Wendy Osher, Maui Now. With 9 new cases on Maui, including the 2 in rural communities, is there any extra effort to conduct more testing, especially in these vulnerable locations?
We've actually, in our Sentinel surveillance program, where we're looking to see where the disease may be spreading, we've oversampled in some of those rural areas, like Molokai, on Lanai, and even in Hana and some of the outlying areas on the Big Island, to be sure that we're not missing things that might be happening there. That's I think, very helpful in keeping track of what's going on there. I believe the mayor of Maui has actually restricted travel for even family members to Hana, which should also help to reduce the likelihood of someone bringing the virus with them, unintentionally, of course, to that community. So that area, at least, has been essentially travel's been even more restricted in that area. So we're trying to do what we can to try to address the issues in those particular communities. I must say that as time goes on, we're going to be looking at very unique situations in Hawaii, and we're going to have to adjust our policies and maybe impose restrictions in other areas as well to be sure that the COVID-19 doesn't spread.
Dr. Anderson, this is from Manolo Morales over at KHON. Do you know how many tests have been done on Molokai and Lanai?
Very few have been done by the private labs. We have sampled them through the Sentinel surveillance program. They are able to test for COVID-19. They send their samples to laboratories on Oahu or in some cases even on the mainland. I can't tell you how many have been actually sent from those areas, but obviously there's been at least one, being that we did find a positive on Molokai. But we are able to do the testing from those remote locations.
Okay. Also, Dr. Anderson, Daryl Huff, H&N, asking you to please recap the details of the 3 deaths by age and gender, if possible.
You're challenging my memory, Daryl.
We can get that to him later if you'd like.
I think that'd be, in the interest of time, best to do.
Okay.
As far as I can remember, they were all Hawaii residents who had become ill, probably because of contact with travelers, with the exception of the one we reported on Monday. She was a middle-aged lady who had no obvious travel history recently, but came down with COVID-19 symptoms and was hospitalized and had passed away 2 days ago. But the others did have a travel history and were probably infected where they were traveling.
Okay. Thank you very much, Dr. Anderson.
Okay.
General Hara, a question for you. Hold on, General. Let's see. There you are. Okay, so this is from Rick Kwan. 2 arrests have been made for breaking quarantine. Are you pleased with how enforcement is going?
Yes, I am pleased, but it's actually 3 arrests that have occurred. Is it?
Is that all?
Okay.
Man of few words. Oh, hold on, General Hara, or Chris Tatum. Since the inbound traveler quarantine went into effect last Thursday, how many homeless people have arrived in Hawaii? Do we know that? And Daryl says, Daryl from H&N, we have gotten reports from at least 3 homeless people. They've gotten reports saying that at least 3 homeless people have showed up at H&L, and workers wrote the address of a homeless shelter on their form and sent them on their way. What is happening to those people?
So I know of at least 1 on Oahu that was put into the homeless shelter, the recently stood up homeless shelter. And there were 3 that went to Kauai, and all 3 were arrested. Okay.
Thank you very much. Dr. Anderson, another question for you from Kristen Concilio, Star Advertiser. Can you tell us how many private doctors have closed their doors amid the pandemic, and what is the DOH doing to help them stay in business?
We've heard anecdotal reports of a number of physicians who have stopped practicing as of late for various reasons. Some of them are not trained to deal with infectious disease. Others are having difficulty obtaining personal protective equipment. For those, we are working to be sure that they have the equipment they need to operate. We're worried as physicians may be leaving practice, particularly private practices, that it'll put more stress on our hospitals and our Primary Care Association is now looking to help to support the patients who don't have physicians available anymore to help them. In fact, we've reached out to them and are discussing with them how we can keep them in business so that they don't have to close their doors. They're a critical part of our healthcare infrastructure, and we need them to be there to help support the communities they serve. And we'll do everything we can to keep them going. Thank you.
Okay. Director Hara has a follow-up on that.
Yeah, I just wanted to add something from the previous question. So Governor Ige talked about those that fly in, if they don't have a place of lodging in Hawaii, that we turn them around and send them back. Unfortunately, we cannot do that by law because they didn't break any laws. So the individual would not be able to abide by the mandatory 14-day quarantine rule. And if we'll give them an option, they can fly back. If they don't fly back, then those are the ones that get arrested.
Okay. Thank you very much, General. All right, I think, Dr. Anderson, we have another one for you here. This is from Ashley Mizuo. DOH says that the community spread cases cannot be pulled out and put on the map separate from the travel-related cases because it would violate HIPAA. How many cases of community spread would we need to have to make a map that is community spread cases specific and not violate HIPAA?
I've never heard that HIPAA is an obstacle to doing that. But having said that, the maps that we have developed are in the early stages of development. We have listed all the cases there, whether they're cases that were associated with community spread or cases associated with travel. We will look to see if there's a way we can distinguish those without violating any personal protections that people have. Most of the cases we have are travel related. As you can see on the chart on my right here again, the orange sections of those bar charts are the community spread cases, those without travel histories. The dark blues which are the majority of the cases we have, are residents who traveled and became infected. And of course, when you look at the maps, you can assume that most of those cases are associated with travel.
Okay, thank you very much. Our next question is for either Mr. Rathel or Mr. Tatum. Will hotels also be willing to accept people who need to isolate, either due to positive tests or contact with a positive patient, group home residents who need to get out of crowded housing, or other non-first responder or healthcare populations?
Thank you for the question. So right now, the Hotels for Heroes is for the healthcare professionals, first responders, and emergency personnel. I know that DIEMA is actually working with all the hotels, and they're evaluating the opportunities and what they'll need, and I know that the hotels will all work with them to do what's needed.
Okay, thank you very much. Next question. Director Hara, I'm not sure you can answer this, but can you give a breakdown of National Guard members per county? We have Kehau asking this question from Maui News. Okay, General.
So my boss told me to come up here and answer that question. But so we're looking at approximately 54 to 57, depending on the county, of National Guardsmen ready to support. So each one, we have a company size, is what we're calling it. So each county has a company size element.
Okay.
Okay.
Thank you very much, General. Governor Ige, next question for you from Wendy Osher, Maui Now. Why wait until travelers arrive to determine if a traveler has a place to stay? Could that determination be made prior to boarding?
No, we don't have any way of enforcing. As I had said, the FAA said that airlines cannot discriminate anyone boarding an airplane.
Okay. Thank you very much. Dr. Anderson, this is for you from Eleni Gill, Civil Beat. When is Hawaii expected to hit its peak based on current modeling, and how many people does the state expect to die?
How long is this going to last? That's a tough question, but having said that, most of the curves that we've looked at, the projections at least, suggest that we're going to be looking at least a month until we actually reach our peak, and then we can expect the disease to tail off. It may be considerably longer than that. Time will tell as to how effective our mitigation measures are. One of the issues associated with flattening the curve is it can be extended a bit when you do that. that's generally considered to be worth the price, because you're not having so many people affected with serious illness that you can't treat if you can extend it a bit. But if the projections are accurate, we're looking at several months before we're going to start seeing the curve begin to drop, and where we can start thinking about relaxing some of the mitigation measures that have been imposed.
All right, thank you very much, Dr. Anderson. Our next question comes from Eleni Gill Civil Beat. This is for Brigadier General Kauivi or Director Hara. Could you clarify what you mean when you say the National Guard will support law enforcement and security to enforce the governor's order? Does that mean restricting citizens' movement, such as roadblocks?
So depending on what the law enforcement agency on the county needs, we will assist them in that manner. So right now we cannot say for sure because we haven't gotten specific requests of all counties. We have some from Kauai, and we're able to assist them, and that's to maintain security checkpoints, in this case on Kauai.
Okay. Thank you very much. General Hara, this is for you, Daryl Huff, HNN. Will soldiers at airports be armed?
The answer is no. None of the soldiers or airmen will be armed on any of the missions. That, of course, could change if the risk goes up. Then I'd make that determination on a case-by-case basis. But no one will be armed at this time.
Okay. It looks like we have one more from Daryl. General Hara. Oh, no, I'm sorry. This is for Governor. If the federal government continues to refuse to allow transfers to FDC, the Federal Detention Center, will you release them, or do you have a plan B to keep them in custody somewhere else?
As you may be aware, the court has appointed a special master to review each of individual and make a determination about whether it would be safe for them to be released. That's what we were asking for, that every individual should be evaluated on the risk to the community before they are set free.
Okay, Governor, one more question here for you. What is happening with RIMPAC? I believe that's in June or July?
You know, certainly I'm not exactly sure at what the schedule is of impact. I will be sending a letter to Admiral Davidson asking that RIMPAC be postponed until the COVID-19 situation here in the islands subsides.
Okay, thank you very much, Governor. Dr. Anderson, another question for you from HNN. Daryl says, you told us yesterday that the testing protocols may be modified to test more people who have been in close contact with positive cases, even without symptoms present. When will that happen?
We've begun to do that already. Health Department has been focusing on contacts who are symptomatic, but as we've noted, the increased evidence of pre-symptomatic infections. We've begun to look at those who were close contacts, even though they have not expressed symptoms. I expect we're going to continue to look to see if we can identify individuals who have been infected and are asymptomatic. But as it is, we're focusing on those individuals who obviously would be at higher risk. This whole question of whether you can transmit the disease if you're asymptomatic is still being evaluated worldwide. And I'm sure our policies will be adjusting to whatever the current knowledge and understanding is of that issue. But it is a significant concern, and another reason why people should wear masks when they're needed and avoid being too close to others.
Okay.
You should assume you are infected and everyone else is infected around you. Thank you.
Thank you, Dr. Anderson. This is for General Kauivi or Director Hara, HNN. What exactly will the role of soldiers be at the airports?
So our National Guardsmen will be at the airports to assist with the existing screening. First off with the temperature screening, and then they're working with the airports in case there are other types of screening assistance they need.
Okay, thank you very much. Governor, you have a question from Rick Kwan, KITV. How do you feel President Trump is doing in handling the crisis? Anything else that he could do for Hawaii?
We have been in close conversation with all of the federal agencies. FEMA Region 9 Director Bob Fenton is very familiar with the needs of Hawaii, and he has been very effective and responsive to our needs. The one area that we haven't received all of the things that we requested is personal protective equipment, and FEMA has, in the last few days, directed the states to pursue their own procurement, and so that continues to be a challenge. We're committed to ensuring that we have the personal protective equipment to keep our healthcare community and first responders safe. We will continue to advocate and search for vendors that can allow us to acquire the equipment that we need.
Thank you very much, Governor. Director Hara, this is from Eleni Gill. Have any long-term care facilities, such as assisted living or nursing homes, received PPE? Anyone else? Okay. Mr. Rayfield?
Our Emergency Preparedness Coalition is distributing PPE to a number of facilities across the state. This is being done on an as-needed basis. As the governor has talked about, there are significant challenges in terms of acquiring enough PPE for the state of Hawaii. This is not only a national problem, it's an international problem. However, we are making decisions on a day-to-day basis, evaluating burn rates. So we are supplying PPE right now to hospitals, long-term care facilities, other facilities. We just shipped, for example, this morning, a batch of PPE to Hana to support the outbreak over there. So we are supplying and distributing supplies on an as-needed basis. It would be great if we had a lot more PPE, we could provide a lot more coverage, but there are decisions being made on a daily basis to do the best we can with what we have.
Thank you very much. Dr. Anderson, for you from H&N, the Health Department is releasing breakdowns on coronavirus cases by county, but there is no data on the ages of those who have tested positive. Can the DOH say what percentage of confirmed cases are under 65?
And when you look at our website, the next time you see it, probably tomorrow, you'll see a breakdown by age. Today's cases, for example, we had 34 cases. They were all adults. There were no children, no individuals under 18 years of age. And overall, we're seeing all age groups affected, possibly with the exception of the younger age groups, which have lower than expected rates of infection, or at least expressing symptoms. So we're seeing a distribution that's consistent with what we're seeing across the country, where a disproportionate number of older citizens are being seriously impacted, but all age groups are being affected. And as you look at our age distribution, normally the age distribution of the cases follows pretty much what our demographics are here. Thank you.
Okay, one more question for you, Dr. Anderson. This is from Eleni Sewell-Beat. How many infections have been confirmed among senior care homes or facilities? Any idea?
I wouldn't want to venture a guess. We can look into that.
Okay.
Thank you.
Thank you very much, Dr. Anderson. And with that, we'll have closing remarks by Governor Ige.
Thank you so much for joining us. I really wanted to remind everyone that the fight against COVID-19 is a marathon. We are at the beginning of April. Our extreme actions to isolate our community, to restrict travel from out of state, to restrict travel inter-island, is all focused on flattening the curve and ensuring that our healthcare system is not overrun by COVID-19 cases. We can only be successful if we work together as a community. Each and every one of us need to take responsibility for our actions. I've often said that we should all assume that we're COVID positive, and we should refrain from social interactions that could infect another. And we should all treat everyone else as if they were COVID positive. We need to keep social distances, stay at home, work at home. We should only be leaving our residents to acquire essential food and other materials. And other than that, we should be at home and maintain social distances. You know, I know that our community always comes together in crisis, and this is another challenge that I know that we can meet. It is so important for each of us to take responsibility. Take care of yourself, take care of each other, and most importantly, let's take care of our community. Thank you.